So we're going to discuss a couple different techniques for scar massage that we can do after we've had a cesarean birth to help keep the scar nice and mobile, help the abdominal wall healing, and just prevent that scar from really creating restrictions through our abdomen and our pelvic floor. And of course, if we're having any scar pain or tenderness, this is a really great way to work the scar to help reduce any of that. So the first technique that we're going to talk about is an indirect massage. So you can start taking pads of your fingers, lightly coming just above your scar. You're going to gently kind of press, and you can slide your fingers up and down, and you can work all the way across the length above the scar. If you find a spot that feels a little more tight or restricted, you can gently kind of hold that area for about 20 seconds into the direction of where you're feeling a little bit of the restriction. So maybe that's pulling down towards the scar or that's pulling up, and then you can gently work your way back. So in a nice kind of up and down. Then we can also move the scar side to side. Again, working along the entire length of the scar, maybe holding at a place that feels a little bit more tight or restricted, and then making gentle little circles. You can do clockwise, counterclockwise, both, all the way down the length of the scar and back. And then we can do those same techniques underneath the scar. So again, up and down, side to side, and little circles. Finding any areas that feel a little bit more restricted and maybe holding the stretch there for a little bit. As the scar continues to heal and it's safe to do some work directly on the scar, we can do some direct massage. So that same technique, this time we're just going to go directly on the scar itself. So again, a little bit of pressure, moving, sliding the scar up and down, side to side, or little circles, all the way along the length of the scar. Again, if we find that this scar doesn't move very well in one direction, we can kind of hold that stretch into that direction, all the way down and back. Circles, side to side. And then we can even do some rolling to the scar. So we want to make sure that we can actually get underneath the scar and lift the scar away from the tissues underneath. So again, trying to pinch between just above and below the scar and rolling that scar, that skin, between your fingers. So this would be some rolling to the scar. And then the tack and stretch is another great technique where you're holding down at one point on the scar, and then your finger comes and just stretching along. So then you tack and stretch, tack, oh, I went off the scar, and stretch, and then same thing on the way back. You can tack and stretch. Even a little like zipper motion where two fingers side to side where you're kind of moving the scar up and down is a great way to mobilize. Again, whatever you feel like maybe there's some areas of restriction or directions of restriction, that's where you want to focus, but it's really great to get across the whole length of the scar in all different directions so that all the layers can slide and glide freely.